It is 8:23. Welcome back. There is a mental health worker shortage in the United States and right here in Indiana in a big way. We've heard from several mental health professionals in central Indiana who say they have been overwhelmed by the number of calls for help that they've been getting. And the numbers back them up. According to the State of Mental Health in America 2021 report, Indiana ranks 43rd out of all 50 states and DC in our mental health workforce ratio. We have roughly one mental health care professional for every 620 Hoosiers. Why is there a shortage and what is the state trying to do to find a solution? Well, joining me live from Carmel is David Berman. He's the Vice President of Mental Health America of Indiana. MHAI, it's the oldest and largest mental health policy and advocacy organization in Indiana. So good to have you with us, David. Let's just jump right in because we don't have a ton of time this morning. Why is there a shortage?
So this is not unique to Indiana. We have this shortage around the country, and there's a number of reasons. We have aging practitioners that are retiring, and we're not attracting younger folks into the field. There's lower insurance reimbursement rates. We're a rural state, lots of rural states. It's hard to recruit and retain mental health professionals in rural areas. So there are a myriad of reasons across the country. Indiana, there's no one good reason. Many of these definitely apply, but we are, as a state, I think, doing a lot to try and mitigate this situation.
Yeah, if somebody is, watching this morning and thinking about going into a career, there are many of them. So we'll talk about that hopefully here in a second. But the provider shortages result in things like really, really long waits for treatment. And some people just don't go to get it because they can't wait that long.
Right. Oh, yeah, absolutely. We have folks that are waiting 2, 3, 4 weeks at times. We have a shortage of inpatient beds, and we have folks that are in desperate need of help, and we need to figure out a better way to reach them, to give them access to mental health professionals.
And Indiana is trying to do some more things to help alleviate this problem, including a new system to handle these mental health calls. What is that?
So we're really excited about this. This is going to revolutionize the way that we do crisis response in the state. So as many of your viewers may know, I know you ran a story on this the other day, so hopefully they do already know that the National Suicide Prevention Lifeline is transitioning to from an 800 number to a 3-digit number, 988, in July of 22. And not only are we going to make it easier to call the crisis line for help, but this gives us the infrastructure for doing some coordinated crisis care, which involves law enforcement officers and first responders and mental health professionals. The goal is to create mobile crisis teams that bring services to people where they are, when they need them, freestanding crisis stabilization units so individuals have a place to go while they're experiencing crisis. That's not necessarily the emergency department, because our emergency departments are not cut out to handle mental health crises. And nobody likes going to the ED anyway.
No. We're going to be talking about that more in depth and some of those teams that are out there teaming, I don't know, maybe a detective with a clinician when they're going out to calls as well. That's coming up in about an hour from now. We sure do appreciate your time. We're going to put up information to get in contact with you all too. For more information on Mental Health America of Indiana, go to fox59.com/links.